Summaries. There are multiple summaries available in the online chart. The summaries that you view are based on your role. Not all summaries contain the same data, but all function the same way, and most summaries contain common elements, but others have additional sections. Inpatient Summary, MPage. The Inpatient Summary is available to all clinical users of eCare. It provides an interactive summary of patient data. It can also increase the ease of adding data for your patient and increase the ease of finding the clinical patient data. Column 1 contains mainly patient information that is not unique to this visit. Column 2 contains patient data from the present encounter, and column 3 contains patient results and order information. In some sections, you can quickly add a piece of data by selecting the plus sign. Each section can be opened by clicking the down arrow and closed by clicking the up arrow. Each section has a header that is a link to that section of the chart. The number in parentheses indicates that there is data available in this section. You notice that the number 2 is in parentheses after the diagnosis header. To view the diagnoses documented, click the down arrow on the diagnosis bar and the diagnoses for your patient displays. To display all of the details documented for each section, click Expand All in the upper right corner of the window. Several of the sections, including vital signs and weights, provides the ability to graph by clicking the blue link for that item. After you have expanded a section, you can use the scroll bar to display additional results that do not display in the current window. If you no longer want to display the data in all of the sections, simply click Collapse All. Medication Administration Record Summary. The Medication Administration Record Summary is a quick way to review all medication administration activity on the patient. When a medication is gray, it has been discontinued, or it is a med student order that has not been approved by a supervising provider. Medications display alphabetically within their respective sections of scheduled, PRN, and continuous infusions. The time range is 4 hours per column, but can be changed if desired. Medications that are due now or in the future display in gray, and those that are overdue display in red. Patient information. The patient information area of the chart is subdivided into several sections with tab headers noted for what information can be found in the section. When you click on patient information from the menu, it will open to the visit list. This screen enables you to change encounters to view encounter-specific information. Remember to be on the correct encounter when entering orders. At the top of the visit list page is a display of all the patient's visits or encounters. The lower area of the screen displays information specific to the selected encounter. The Patient Demographics tab displays basic demographic information. This is not a face sheet, and the insurance information will display in the Financial Information link on the menu. The Patient-Provider Relationship PPR Summary tab displays a list of users who have opened the patient's chart. Each time you establish a relationship with a patient by opening the chart, your name displays on the list. The PPR summary is regularly reviewed by security to verify that only associates directly involved in the patient's care are accessing the chart. Remember, if you do not have a legitimate reason to open a patient's chart, do not do so. The Allergies tab allows you to add, delete, or modify allergies as needed. All allergies that have been documented display on the screen, even if canceled. You can filter the screen to show only active allergies. Allergies can also be updated and/or changed from the patient's banner bar. The Immunization tab displays immunizations the patient has received during an inpatient visit or documented in a St. John Providence Health System provider's office that uses the eCare electronic health record. The growth chart table shows various charts regarding height, weight, and the age of the patient. The Problems and Diagnosis tab displays problems or diagnoses documented during an inpatient visit or documented in a St. John Providence Health System provider's office that uses the eCare electronic health record. The diagnosis displays only diagnoses associated with the selected encounter. The Problems section displays problems entered across all encounters. If the patient has had any procedures, the Procedure tab will list all of the patient's procedures. Change encounter. Some information, such as orders and diagnoses, are specific to a single encounter. It doesn't matter when or where the testing was done within the St. John Providence Health System, but test results can be viewed in the patient chart on any encounter. The current selected encounter is reflected on the demographic bar, which displays the MRN and the FIN numbers, unit or facility, and admission date. Your patient tells you that he had a steroid injection ordered at his last visit to this hospital, and you want to know the name of the doctor that ordered that injection. To do so, you will need to view his previous encounter to see that information. The visit with the dark blue background is the chart that is currently open. To change the encounter, double-click on the desired visit date. You will be asked to confirm that you want to change your patient's chart to the selected encounter. For this instance, you would select Yes. Note that the encounter information now shows the previous visit information. To find the name of the physician, click on Orders from the menu, and Inject Steroid Epidural will show in the Orders profile. To the right, it will show that Gary N. Mason, D.O., ordered the injection at the last visit. You have completed the video for view results. Thank you.